Hi everybody, it's Shannon. I thought I'd check in with you and give you a little update. A lot has happened since the last time I gave you an update. I did go in and I had my splenic embolization and all that went really well. I think like I told you, there is pain involved after it's over. So when your physicians tell you that, they're not kidding. But I got through the pain and all that kind of good stuff, and that was okay. On Sunday, the Sunday before Thanksgiving, I was up. I hadn't been sleeping well. I hadn't been doing well on Saturday either. I was really, I don't know, at one point I was kind of like lightheaded and nauseous, but I drank some juice again, so I just chalked it up to having my blood sugar too low or whatever, which turns out that's not at all what it was. So I spent a lot of Saturday just in bed, resting. Then Sunday came along and I did kind of the same thing, and I seemed to be feeling a lot better on Sunday, except for Sunday night. So I guess it was like early Monday morning, like 4 o'clock. I really couldn't sleep. So I was like up and down and to the living room and back to the bedroom and to the kitchen and, just wandering basically. And finally I kind of sat down and I was like, okay, I'm going to try to go to sleep in the recliner because the bed just was not working. So I tried to do that and I was like, stayed there probably about 15, 20 minutes and that wasn't working. So I decided to get up and go in and just, lie in bed. So I got up, I went and I got into bed, and then all of a sudden I felt horrible, like I was going to throw up. And so I sat up really quickly and I figured, okay, maybe I just, laid down too quickly or something like that. And that was like interfering with my stomach or something. I don't know. Anyway, I'm trying to at this point, rationalize my way out of it being something. So once I couldn't rationalize it being anything else and I felt like I was going to throw up, I went to the bathroom and I could barely make it because I was I thought I was going to pass out right there on the floor. But I did make it. And then, but I'm still I knew that wasn't good. And so I'm somehow I ended up with tissues in my hand and I was coughing. And the last time I coughed, I happened to look down at the tissues and there were little clots of blood in the tissue. And I thought, all right, coughing up blood and, feeling like you're about to faint, these are not good things put together. So I called my husband and he really quickly woke up, which always amazes me because normally he's not quick to wake up. So I told him, you have got to call an ambulance, call 911, something's wrong. And he was like, no, I can get you there faster. So he just tore on some clothes, he passed me some stuff and I put that on and away we went to the hospital. And, the closer we got to the hospital, kind of the better I was feeling. But in the back of my mind, I still knew whatever just happened was not right. But I knew that if I got to the emergency room and they didn't take me straight back, that it was really not a big deal. And I knew that if they took me straight back, that it probably was. And so my husband, pulled up under the awning thing and went and got a wheelchair and put me in it and brought me to the entrance. And they looked down at me and they said, what's her name? And I told them my name. And they said, we need to get you back right away. So that's when I knew, okay, first of all, I was right to come. And second of all, I must look horrible. So they put me back in this huge room. And they ordered blood draws, they ordered chest x-ray, they ordered an ultrasound, they ordered just I mean, you name it, it got ordered. And so the x-ray part came to me, so I didn't have to move for that. The blood draw, I was very happy. They actually did it through my port. So they accessed my port and did it through there. And I told them that I was also feeling like right before I started coughing, I was very short of breath. Like I just couldn't catch my breath very well. And so in my blood counts, they found that I guess you're supposed to have between like 8 and 12 units of blood in you at any one given time, and I had like 5. So the first thing they did was we have to give you a blood transfusion. In fact, we're going to do 2 units and give you 2 blood transfusions. So I signed all the paperwork on that, and down that came, and they hooked that up really quickly. Then, so after that, they were like, well, we could do a couple of things. They really wanted to do an endoscopy, which is where they go down your throat to your stomach and look for any sort of active bleeding, which I honestly didn't think they'd find anything. I was like, I don't know what you're going to do there, but okay, whatever. But they said, the first and foremost thing that they had to do was to get all the blood into me. So we waited on that until I was able to get the 2 units of blood in me, which took, I think, about, 2.5, 3 hours, something like that. But the rest of me, they said, was at least stable. So they weren't that concerned that they weren't doing the endoscopy like right away. So I got the 2 liters of blood done right away. They said, we're going to move you up to ICU. So because they were putting me in ICU, that's when I really knew it was bad, was that this was not going to be like let me give you this and you can go home, or let me do this and you can go like to the oncology wing or something. When they said, all right, we're going to put you in ICU, I thought, ooh, geez, okay. So they had to find another vein, which is not easy these days, to find a vein that's not going to blow on a poor nurse. I feel so sorry for them when they try it. But when you go to ICU, they require 2 different entry ports. So my port counted as 1, but I still had to get another one. So I ended up getting it on my right arm, which is not an ideal place, but it was the only one that wasn't blowing that day. So I got it done on that arm, and they took me down to ICU, where I had the most wonderful nurses ever. I had Clay during the day, and I had Taylor at night, and I was there, I think, 4 days in ICU. But the very first day I was there, it was nice because they, like I said, if you're in ICU, things come to you, which I didn't realize that because I'd never been in ICU before. So once I had the 2 units of blood in me, then they ordered the endoscopy. And I got a really great GI doctor. And he said, all right, we're going to do this. I'm going to look down your throat. We're going to see what's going on since you coughed up a little bit of blood. Maybe there's more, maybe there's not. We'll just have to see. So I said, whatever. And I gave him my whole spiel about I metabolize, twilight anesthesia quickly, da-da-da-da-da. So because of that, they send not just a nurse anesthetist, like he's there too, but they'll also send somebody from anesthesiology to sit with you to make sure. So I thought that was interesting because I didn't know they did all that. But anyway, so they put me under. First they have to put the thing in your mouth that you bite down on, because otherwise if they put you under first, they'd have to like pry your jaw open. It'd be very difficult. So they have you bite down on the thing, which causes most people to gag. So as soon as it goes on, like they hit the button and you're out. When I woke up, they told me that I had basically what equates to, hold on, let me make sure I can say it right. Esophageal varices. Ha! I got it. Which is like having varicose veins, but in your esophagus. So it's like all these little rips and tears all throughout my esophagus. So blood, every time it would just pump up, you know, it didn't have anywhere to go any faster. So it would just go like and fill up wherever it could. So I had all this old blood and stuff in me, which after I had done the endoscopy, and they were like, okay, you can have some ice chips. Well, as soon as I started in on the ice chips, let me tell you, I was like a puking fountain. It was absolutely disgusting, and it was all old blood. So they were like, well, you know, let's get that out of there, but still, you know, throwing up is not a good thing because you'll lose the banding that we've done. So what they do when you're under, if they find that you have esophageal varices, is they put these bands around your esophagus, and they kind of work like Band-Aids, whereas, you know, it keeps the blood within the esophagus or within the wherever it's supposed to be, not in the esophagus, within the esophagus, I don't know. But it also helps promote scar tissue. So they're trying to make, you know, like little scar tissue that will forever be there and that will forever act like Band-Aids. So they did that, and I will say, after I stopped throwing up, because I had to be on ice chips then for like another whole 2 days or something. After that part was over, like I could tell a difference. There was something that was remarkably different in my throat, and I could feel it. And so that's when I knew, like, okay, I think they have hit one of the things that was wrong with me that I really didn't think was wrong with me. Like, I just kind of thought it was like, oh, maybe you're having like heartburn sometimes, you know, or something like that. And it really wasn't even that bad. Like, I didn't take Tums or anything. So I was like, oh, maybe it was something like that. But it ended up being this instead. So I got all that done. I stayed in, that was Monday then. And I stayed there until, I don't know, I guess it was Wednesday. Because I was still there for my birthday. And it was so sweet. The nurses were so wonderful. They got balloons for me. They got like cupcakes. They special ordered cupcakes with like the pretty frosting and everything. They had food service to a plate that wrote like happy birthday around on the top in like that strawberry stuff. And then they did like pound cake with strawberry sauce and some whipped cream on it. I mean, it was all just so sweet. And they came and they sang to me at my bed. I mean, it was just, I could not have asked for a better like crew of nurses. They were absolutely phenomenal. I also love that, you know, when you're on ICU, they don't ever really like question like what pain you have, or should you be taking this drug, or have we given you too much of this, or are we worried about you becoming some opioid addict? Like, they were all about like, let's just make you comfortable. Let's make it so that you don't want to puke up any more blood. Let's make it so that, you know, all of this is going to be okay. And that was so nice. Finally, I was, you know, able to tolerate liquids. So I could drink liquids and that sort of stuff. Now, I will say, I have lost my appetite completely. You know, I mean, after all that, you just kind of lose it. So, it is what it is. But from all of that, I ended up having to go, after that, you know, and they had me stabilized and everything, and I really didn't need like a one-on-one nurse anymore. So I was stable and everything. They decided to put me on the oncology floor. So I went up to the oncology floor, and they were just as fabulous up there. Absolutely wonderful. And they, you know, made sure that all my medication was given on time. If I had a question for the doctor, they put it in immediately and they got me an answer like within 30 minutes. I mean, it was really excellent, excellent patient care. So I stayed there until Saturday night. So it was finally Saturday night that I was able to come home. I'm sure I have glossed over a few things that I'll remember later. But Saturday night I finally got to come home. And, you know, it's just, even though the nurses and everything were absolutely fabulous, there's nothing like sleeping in your own bed or sleeping just in your own house with your own things around you. That's so much better than, you know, sleeping in any kind of hospital. But again, if I had to pick a hospital to stay in, I'd be staying at Northside Forsyth Hospital. That would be my hospital of choice to stay in because they were absolutely fabulous. So that's what's been going on with me. I did tell the GI doctor, I said, look, I have a trip planned to go to Egypt on December the 18th. How is this going to impact my trip? And I fully expected him to say, well, you're obviously not going to be able to go to that. And instead, he was so great. He was like, you know what? I will fit you in over the next 2 weeks, and we'll have to do another endoscopy with the banding again. He said, because, you know, there's not enough banding around you right now. And so he said, I will have to go back in. I'll have to do that again. He said, but I'll get you there. He said, that's not an issue. I'll find the time. And I thought that was so nice. So he did that, and I'm going back to see him and having another one done next Tuesday. And then I have to go see my oncologist because he wants to have all of these things like written out and explained to whoever it is that I might question anything that I bring with me. You know, what my pain is, what my prognosis is, what my diagnosis is, all that kind of stuff, which I thought was really sweet too. So out of all the doctors that I saw, it's my oncologist who I think is the most concerned about me going. And I told him, I promise you I will wear a mask on the airplane. I will only drink bottled water. You know, I'm not gonna eat or drink anything that's been raw or that didn't have a peel or anything like that. So I think it's gonna be okay. I'm going anyway. But yeah, that's been my life in a nutshell over the past, you know, little bit. So it was just not what I was expecting. I wasn't expecting to have, you know, Thanksgiving in a hospital. I wasn't expecting to spend my 50th birthday in a hospital. I certainly will never forget that. But I am glad that they got to the bottom of what that was really quickly. Like, I consider it quick. The GI doctor is like, my God, you have one of the worst cases I've ever seen. I don't know, I didn't think I was that bad. It didn't hurt or anything. To which he still doesn't believe that it didn't hurt any more than what I say that it hurt. But I said it just didn't. I mean, I go again with, once you have stage 4 cancer and they start pricking and poking and everything at you, you know, to add one more little thing to something that may or may not feel kind of like heartburn does. I mean, that's like nothing. Give me a break. So, I feel pretty good now, though. I still get short of breath. But that's about it. So, and I do take naps. I've like reverted back. Before, I was just like in the toddler mode where I had to take one nap in the afternoon. Moms, you'll appreciate that. You know, the one nap in the afternoon is what we're down to. I am back up to the infant time where you have the nap in the morning and then you can do a few things and then you nap again in the afternoon. That's where I am now. So, I still have to take 2 naps a day now. But everything's looking up. And, I mean, I don't know. apparently I did look like an Oompa Loompa for a little bit, which if you've seen any of my other videos, you know, that's when I like turn yellow because there's something going on with my liver or whatever. And it ticks me off when my husband doesn't tell me I look like an Oompa Loompa. And so yet again, this time he did not tell me that I look like an Oompa Loompa. But apparently I did for a time there. Looked like a gray, ashen Oompa Loompa. I'm not sure how that works, but that's the other reason why they can't figure out like how I got. They really don't know why or who gets esophageal varices. Kind of like they can't really figure out who gets regular varicose veins. It's not hereditary. It might have been like if I had cirrhosis of the liver, but every doctor is like, your liver is fine. Like, you don't have cirrhosis of the liver. So we really can't figure out why this is doing this to you. So that just put me in the pot where everybody else was, which honestly made me feel better. So anyway, I think that's about it. I will probably have another update of all the things that I forgot to tell you during this update. Because, you know, chemo brain is real, my friends. So anyway, I shall talk to you later. Stay strong and be positive because you get to choose your emotion. I'll talk to you later. Bye.